Well, that is my message is that is an incredibly dangerous thing to actually do if you're in Sydney or if you're in Victoria or the ACT, and it may well be dangerous in any other part of Australia that gets the Delta variant. The risk of anything going wrong with the Astra vaccine if you're over 60 is tiny. If I prescribed Astra today for one of my 65-year-old patients, it would be the least risky thing that I did as a doctor today.
I wanted to ask you about New South Wales because it is in a precarious position. The Premier Gladys Berejiklian flagging yesterday that New South Wales will probably get to 70% fully vaccinated some point in October. That will also be the peak of the ICU admissions in this outbreak. How will the hospital system cope?
I think the first thing to do is to acknowledge the incredible efforts of staff on the front line in New South Wales. It is a challenging, a fatiguing and exhausting situation. And I think there will be a decoupling of the number of cases and the rate of rise of the cases from the rate of rise of hospitalisations and intensive care. We've actually seen that around the world, particularly in places like Israel. But what we don't know is when that uncoupling will occur with the Delta variant. There is sufficient ICU capacity in Sydney to manage the predicted number of cases. That's what Premier Berejiklian and Health Minister Hazzard are talking about. But there does need to be, and we're experiencing this in Canberra as the Victorians are as well, you need to look at your workforce. You need to make sure that you're distributing the workforce appropriately across your hospitals. And sometimes you need to repurpose or redeploy, I would say, doctors and nurses who are in other parts of the hospital to go into places that there is need, and that might be intensive care, that might be in vaccination, or it might be testing.
So you agree with the Prime Minister Scott Morrison then that it's more a workforce issue and having the capacity there rather than hospital beds or ICU capacity?
Well, we know from 2020 that we spent a lot of time procuring ventilators and making sure we had surge plans. We've got to remember that every single jurisdiction actually had surge plans that were going to cater for situations like we saw in New York or Italy. So there's good plans in place, and we're never going to get to that situation, those tragic scenes that we saw elsewhere in the world in 2020. We're actually not going to get there now because we've got the vaccine. So those plans are in place, and we've also got private hospital capacity where there's an excessive burden of COVID-19. You can stop elective surgery and get staff that are freed up from that. So there's a lot of fat left in the system. I think that we do have to be honest with that. We're not going to find ourselves with COVID patients on the streets. It'll be tough, but I think we'll be able to do it.
Dr. Coatsworth, I wanted to ask you something that the audience continually asks us, and that is what treatment there is for people who get COVID-19, and particularly those who end up in hospital. What sort of drugs are they given to aid in their recovery?
Karina, the good news is that we're learning more and more in the past 18 months about how to effectively treat COVID-19. One of the mainstays of treatment is a really simple drug called dexamethasone. It's a steroid, and accompanied with some of the newer drugs. The idea is that you're switching off the inflammation because it's not actually the virus, it's the inflammatory response that tries to clear the virus from the body that causes so much lung damage and puts people into respiratory failure. So you come into hospital, you get oxygen, and pretty much as soon as you're getting the oxygen, you're getting the steroid, you're getting the other newer anti-inflammatory agents. And there is a new drug now called sotrovimab, which has just come into the National Medical Stockpile, which is also a welcome addition to our COVID-19 treatment and is usually used for patients who are at risk of getting into hospital and intensive care, but who may benefit from early treatment. And that's been distributed around the country this week.